You're over 60 and you've started to notice something. Your erections aren't quite what they used to be. You wake up in the morning and that firmness you once took for granted simply isn't there anymore. Perhaps you've noticed your desire fading a bit, your energy levels dropping. Well, I need you to listen very carefully to what I'm about to share with you today, because this information could genuinely transform your intimate life and your overall health. And it all begins with something remarkably simple, something you do just before you go to sleep each night. I'm Dr. Amelia Wright, and I've been practicing medicine for over 25 years now, specializing in men's health. I've worked with thousands of men across the country, from busy London professionals to retired gentlemen in the Cotswolds. And I can tell you that what I'm about to explain is something most people simply don't know about. Yet the research is absolutely clear on this. Here's the warning I give to every single one of my patients. If you're not doing this before you go to bed, your body will gradually disconnect from its sexual power. And here's what's crucial to understand. It's not because of your age. It's because of an accumulation of small errors that often go completely unnoticed, night after night, week after week, until suddenly you realize something fundamental has changed. Let me be absolutely straight with you. The quality of your nocturnal and morning erections is one of the best indicators we have of your cardiovascular and neurological health. When they start to disappear, it's your body telling you that something isn't quite right internally. A study published in the British Journal of Urology found that men who regularly experience morning erections have significantly better cardiovascular outcomes than those who don't. This isn't just about sex, everyone. This is about your heart, your circulation, your entire well-being. But before I share the solution with you, let me explain something absolutely fundamental. What actually happens inside your body whilst you're asleep? During deep sleep, particularly during the REM phase, your body activates a whole series of vital processes for regeneration. One of these processes is the production and maintenance of spontaneous erections. Yes, even if you're not having any sexual activity whatsoever, your penis activates whilst you sleep. This happens naturally between 3 and 5 times every single night. It's been happening your entire adult life, whether you were aware of it or not. Now, why does this occur? Well, there are 3 crucial reasons. Firstly, it's your body's way of maintaining the erectile tissue in good condition. Think of it like taking your car for a spin regularly to keep the engine healthy. Secondly, it stimulates circulation and oxygenation of the penis, keeping everything supplied with fresh blood and nutrients. And thirdly, it helps preserve sensitivity and sexual performance over time. So what happens when these nocturnal erections start to disappear? I've seen it time and time again in my clinic. The tissue begins to atrophy. Blood flow diminishes. The elasticity of the corpus cavernosum reduces gradually. The risk of permanent erectile dysfunction increases. And all of this can happen silently, night after night, completely unnoticed, until one day things simply don't respond anymore. I had a patient come to see me last year, a lovely chap from Birmingham, 67 years old. He'd been a builder all his life, strong as an ox, never had any health problems. But he came to me absolutely devastated because intimacy with his wife had become impossible. When we traced back through his habits, we discovered that the decline had been happening gradually over 3 years. 3 years of silent deterioration that could have been prevented. So what can you do before going to sleep to prevent this from happening to you? Here's the key that nobody tells you about. First and foremost, have your dinner at least 3 hours before bedtime. Eating heavily just before sleep blocks your circulation. Your body concentrates all its energy on digestion rather than regeneration. This reduces the production of nitric oxide, which is the molecule that allows erections to happen in the first place. Research from Imperial College London demonstrated that late-night eating significantly impairs vascular function during sleep. And if you're also having alcohol or sweet treats in the evening, the effect becomes even worse. I know it's tempting to have a bit of pudding after dinner or a nightcap before bed, but your body pays the price whilst you're sleeping. Secondly, avoid screens for 60 minutes before bed. The blue light from your mobile phone or television suppresses melatonin production, which is your deep sleep hormone. And without deep sleep, you won't get those nocturnal erections. Furthermore, lack of proper rest generates stress, and stress absolutely kills desire. I always tell my patients to create what I call a screen-free sanctuary in the hour before bed. Read a book, have a chat with your partner, listen to the radio. Your grandfather didn't have a smartphone glued to his hand before bed, and his generation didn't suffer from these problems nearly as much as we do today. Thirdly, do this breathing exercise before you go to bed. It takes just 2 minutes, and the effects are remarkable. Breathe in through your nose for 4 seconds. Hold for 4 seconds. Then exhale slowly through your mouth for 6 seconds. This activates your parasympathetic nervous system, which is the system that relaxes you, repairs your body, and improves your circulation. Do this 5 times before bed, and you'll feel your body entering an ideal state for sleep and regeneration. I've had patients tell me this single technique has transformed their sleep quality more than anything else they've tried. Fourthly, drink a glass of warm water or a natural herbal infusion. Your penis needs proper hydration to maintain firmness. Nocturnal dehydration thickens your blood, makes flow more difficult, and can cause microlesions in the erectile tissue over time. A nice cup of ginger tea, some chamomile, or perhaps some warm water with a squeeze of lemon is perfect before bed. Here in Britain, we love our cuppers, so this shouldn't be too difficult to incorporate into your evening routine. And fifthly, and this is absolutely crucial, you must get proper sleep. Sleeping less than 6 hours per night reduces testosterone by up to 30%. And without adequate testosterone, there's neither desire nor power. A major study from the University of Chicago confirmed that men who slept 4 to 5 hours had testosterone levels comparable to men 15 years older. Think about that for a moment. Poor sleep is literally aging you prematurely. So, to summarize this first part, if you're a man over 60 and you want to maintain your potency, don't wait for some miracle pill to solve everything. Start with something far more powerful, your bedtime routine. Because if you don't give your body the rest, circulation, and environment it needs, night after night, you'll lose something truly invaluable, your intimate vitality. Now, have you recognized yourself in any of this? Put a 1 in the comments if you're already experiencing difficulties with your morning erections. Put a 0 if you want to prevent problems before it's too late. And if you've learned something new today, write "I am awake" in the comments, because talking about these matters openly is part of being a conscious, health-aware man. Right then, let's move on to what comes next. I want to talk about 3 morning exercises that reactivate blood flow to the penis in less than 5 minutes. So you can wake up each day with more power, more confidence, and more control. In the first section, we talked about what you need to do before sleeping to preserve your erections. Now, let's discuss what you should do when you wake up. Because yes, what you do in the first few minutes of your day can make the difference between a day full of energy with active circulation and healthy desire, or a day of fatigue, apathy, and weak or non-existent erections. Listen carefully to this. Your penis doesn't have a bone, but it absolutely needs movement. And I don't just mean sexual movement, I mean bodily and vascular movement throughout your day. Why? Because erections depend entirely on blood flow. If your blood is stagnant or circulating poorly, there simply won't be any power down there. This is why, if you're over 60 and want to keep your virility active, these 3 exercises I'm about to teach you should become part of your morning routine. They take only 5 minutes, and the results become visible within days. I've prescribed these to hundreds of patients over the years, and the feedback has been consistently positive. Exercise number 1 is pelvic activation. I call this waking up your control center. It's a series of gentle movements that stimulate the pelvic floor, which is the muscular base that supports your bladder, your prostate, and yes, your penis. Here's how to do it properly. Stand up straight with your legs slightly apart. Contract the muscles you would use to stop the flow of urine midstream. Hold that contraction for 3 seconds, then release. Repeat this 10 times. This exercise activates the pubococcygeus muscle, which we call the PC muscle for short. This muscle is responsible for the strength of your erections and your control over ejaculation. Do this every morning when you wake up, even before getting out of bed if you prefer. You can do it lying down, sitting on the edge of your bed, or standing up. The key is consistency. Exercise number 2 is nitric oxide breathing, which sends oxygen directly to the penis. Nitric oxide is a fundamental molecule for achieving erections. Without it, the blood vessels in the penis simply won't dilate, and blood won't arrive with sufficient force. How do you stimulate it naturally? Through deep, controlled breathing. Here are the instructions, and this takes just 2 minutes. Breathe in deeply through your nose for 4 seconds. Hold the air for 4 seconds. Exhale slowly through your mouth for 6 seconds. Rest for 2 seconds. Then repeat. Do this 6 times when you wake up. It increases blood flow, relaxes your arteries, and improves your mental state as well. And here's a bonus. It also reduces sexual anxiety and improves your performance during intimate encounters. Many of my patients who were feeling nervous about intimacy found that this breathing technique alone helped them feel more confident and capable. Exercise number 3 is standing knee raises, which I call pelvic pumping. This one is simple but remarkably powerful. Stand upright and relax your arms by your sides. Bend your knees as if you were marching on the spot without actually moving forward. Raise each knee as high as you comfortably can, one at a time, in an alternating pattern. Continue for 1 minute. This movement improves circulation in the pelvic region, activates the muscles of the lower abdomen, and helps push blood towards the penis naturally. Do it in the morning after you've been to the loo, or whilst you're waiting for the kettle to boil. It's that simple to incorporate into your daily routine. Now, I must be clear about something important. These exercises don't replace medical treatment if you have an underlying condition, but they are a vital step in taking back control of your sexual circulation. And the earlier you integrate them into your life, the more benefits you'll experience. Firmer erections. Fewer involuntary nighttime issues. Better ejaculatory control. More morning energy. These are the results my patients report after just a few weeks of consistent practice. Let me give you an example. I had a patient from Manchester, 71 years old, who'd virtually given up on his intimate life. His wife was understanding, but he felt he'd lost something essential about himself. I prescribed these exercises along with some lifestyle modifications, and within 6 weeks he reported significant improvements. He sent me a lovely card at Christmas saying he felt like he'd turned back the clock by a decade. To summarize this section, your sexual potency doesn't disappear overnight. It weakens gradually through poor routine. And if your routine doesn't include activation, movement, and proper oxygenation, then your body begins to shut down without you even realizing it. These 3 exercises aren't just physical movements, they're a declaration of self-care. They're a message you send to your body saying, I'm here, I matter, and I won't let myself fade away. Are you ready to try these starting tomorrow? Write active in the comments if you're going to do them. Write, I already do it, if you've already got your own routine. And write, show me if you'd like me to demonstrate these in a video or animation format in the future. Now, let's address something that might be causing you problems without you even knowing it. The 3 worst mistakes that destroy your erections without you realizing. You might be doing everything correctly, or so you think. But you've noticed that your erections still aren't what they used to be. you're sleeping reasonably well. You're eating more or less healthily. You might even be doing a bit of exercise, but your desire and firmness continue to decline. Is it possible that you're making one, two, or even all three of the mistakes I'm about to reveal? These errors are so common that most men don't even consider them problematic. But believe me, these silent habits destroy your sexual vitality little by little. And if you don't correct them in time, recovery becomes increasingly difficult. Mistake number 1 is drinking alcohol as a nighttime relaxant. Just a small glass to help me sleep better. A bit of wine with dinner doesn't do any harm. It helps me unwind after a long day. Sound familiar? I hear this from patients constantly. Yes, alcohol might make you feel drowsy, but what most people don't realize is that it completely blocks the REM phase of sleep, which is precisely when spontaneous nocturnal erections occur. Additionally, alcohol reduces testosterone levels, slows blood flow, affects the central nervous system, reduces sensitivity and firmness, and perhaps most dangerously of all, it normalizes sexual disconnection. It switches you off without you even noticing. I understand that British culture often revolves around the pub and social drinking. I'm not saying you can never enjoy a pint with your mates, but if you're having alcohol every evening as a sleep aid, you're actively harming your sexual health. What should you do instead? Replace the alcohol with a natural infusion. Ginger and turmeric tea is excellent. Warm water with lemon works wonderfully. Chamomile or valerian root tea will help you relax without the hormonal effects. Your body will thank you for it, and so will your erections. Mistake number 2 is spending hours sitting without moving. This is one of the greatest enemies of male sexual health, and it's also one of the most invisible. After 60, many men spend the majority of their day sitting, whether that's in front of the television, at the computer, in the car, at the dining table, or propped up in bed before sleep. And this doesn't just slow circulation, it compresses the pelvic area and reduces blood flow to the penis. In other words, your own daily routines are causing your sexual power to atrophy. I see this particularly in men who've retired and find themselves spending far more time seated than they ever did during their working years. What should you do? Every 30 to 45 minutes, stand up and walk around for 3 minutes. Do some gentle squats or stretches. If you can, invest in an ergonomic chair that doesn't compress the perineum. Movement equals circulation, and without circulation, there's no erection. I had a patient who was a retired accountant from Surrey. Spent most of his day doing crosswords and watching cricket on the telly. Lovely man, but his pelvic circulation was dreadful. We introduced a simple rule. Every time the adverts came on, he had to get up and move about. Within 2 months, he reported noticeable improvements. Sometimes the simplest interventions make the biggest difference. Mistake number 3 is thinking that sex ends with age. This is the worst mistake of all, because it's not physical, it's entirely mental. Many older men believe things like, "At my age, it's not necessary anymore," or "I don't have a partner, so what's the point?" or "that part of my life is over." This silent reasoning extinguishes desire completely. Here's the truth. Your body continues to produce desire, sexual energy, and blood flow well into old age. But if your mind gives up, your body obeys. Sexuality doesn't have an expiration date. It only rusts when you ignore it. What should you do? First, acknowledge this tendency if you recognize it in yourself. Take your intimate health seriously. Incorporate small daily actions that maintain your connection with yourself. Conscious self-exploration, gentle massage in the lower regions, moderate physical activity, emotional connection with a partner, or even with yourself. Don't let the flame go out simply because there's no fire at the moment. Sometimes what's missing isn't capability, it's simply the decision to remain engaged with this part of your life. I want to share something with you. A 72-year-old patient of mine told me that he still wakes up with strong erections during the night. He came to see me not because he had problems, but because he wanted to maintain what he had. That's the attitude I wish all my patients would adopt. Prevention, not just cure. So here's my final reflection from this series. Your erections aren't just about sex. They're indicators of cardiovascular health, hormonal well-being, and vital energy. Maintaining them isn't vanity, it's dignity. It's about staying connected to your body and your vitality as you age. After 60, every choice matters. What you do when you wake up, what you do before you sleep, what you eat, what you think. All of this either builds or destroys your sexual potency, and today you know exactly how to change things for the better. Did this information resonate with you? Put a yes in the comments if you're going to eliminate at least one of these mistakes. Put a yes if you'd already noticed one of these habits, but didn't realize it was affecting your erections. And write, I want more if you'd like a new series on foods, supplements, or strategies specifically for older men. Thank you for staying with me through this series. If you know an older man who needs to hear this, please send him this video. He might not ask for help himself, but he needs to know this information. Subscribe to the channel, hit the notification bell, and stay tuned, because in the next video, we'll be talking about habits that naturally increase testosterone after 60. And believe me, that's another level entirely. Your sexual health isn't a luxury. It's part of your power as a man, regardless of your age. And it's something worth fighting for. Take care of yourselves, everyone. I'll see you in the next one.